It's been a little over a month since indoor mask requirements were broadly lifted here in Korea, and pundits believe prospects of a further ease in remaining restrictions are likely in the months ahead. So what do our current COVID-19 tallies tell us about the pandemic situation here? What are the prospects of a complete lifting of mask requirements as the weather gets warmer? And what are the prospects of lifting the mandatory isolation for COVID-19 patients? Welcome to Issues and Insiders. Today, schools here in Korea are ushering in their new academic year in the absence of indoor mask requirements and plexiglass for the first time since the year 2020. Accordingly, for more on the pandemic situation here in the country, I have Professor Kim Moon Kyu from Yonsei University. Professor Kim, it's been a while. Welcome back.
Thank you for having me.
I also have Doctor Kim Seung-taek from Institut Pasteur Korea. Dr. Kim, it's a pleasure to have you back.
Thank you.
Right. Professor Kim, we'll start with you then. What is your current assessment of Korea's daily COVID-19 tallies?
Well, many scholars predicted that by the end of last February, this pandemic will turn into endemic. And since last week, the daily tally of Korea decreased less than 200 patients per million. That's a good sign, and it's continued to decline. And now we have a reproduction ratio less than 1.0. which means it's definitely declining. I think almost all of the patients are infected by Omicron variant, and if there's no more variant, I think this might be the end of the pandemic. And there are many kinds of subvariants of Omicron in the world, and Korea seems to have BA.5. But in the United States, it's already changed to XXB.1.5. So if that comes into our country, we might have a little bit rise, but still, it's a subvariant of Omicron. And if you're already immune against Omicron, that means you don't have a high chance to get infected with this new variant. So we have to wait and see for this one.
Right, I see. Dr. Kim, the broad lifting of indoor mask requirements in late January does not appear to have led to any tangible rebound in COVID-19 infections here in the country. Do you suppose then, as Professor Kim has mentioned, that we are indeed in the final stages of this pandemic?
Well, I want to be actually just very cautious, because even the WHO said now still just a public emergency, a public health emergency of international concern. Just they are actually trying to be very careful. And then I think all the stats that we are actually observing right now is actually determined by our just population immunity. So which means that now the most of people are got just the immunity against this COVID-19, whether it was due to some natural infection or just a vaccination. But I think this is actually a very good sign. But our immunity, especially our just antibody levels, is not actually long-lasting. It will actually decline. So depending on those antibody levels, we might get some vulnerable to just a reinfection. So we will see, I think, some just more of just up and down. But I think the whole magnitude of even the surge would be very just small compared to the past that we have observed so far.
Right, I see. And against that backdrop, Professor Kim, authorities here have spoken about the possibility of completely lifting the mask mandate, that is, this summer. What are your thoughts regarding this planned measure? Well,
if we think positively, I think that will be this summer or a little bit even earlier, I guess. But to have a more accurate answer for that question, I wish that we can have another nationwide antibody screening test, because it gives us a very clear evidence for making decisions. December 2022, we had a nationwide antibody test, about 10,000 cases, and about 98% had antibody because of vaccination or natural infection. And the natural infection rate was about 57%. And we had another test in January 2023, and the antibody test was about 98, same, but natural infection rate increased to 70% from 57. So that means even though you have antibody due to a vaccination, you're still getting infected with the Omicron variant. If it continues to rise, that means people are getting more immune against COVID-19, and that can be an evidence for lifting of the mask.
The complete lifting of face masks,
Yeah,
then?
but I think the government will continue to have a relatively conservative stance because WHO has a similar opinion.
Right, indeed. Dr. Kim, there is also talk about lifting the mandatory isolation for COVID-19 patients. How do you respond to this potential move?
Well, this is something we have to actually pursue in the future because, well, compared to the flu, we do not actually just isolate the flu patient. So that would be just the same for the some COVID-19 patient. But the thing is that we have some plan just to protect some vulnerable people, because even still vulnerable people, even including elderly people and immunocompromised patients, and also people with underlying medical condition. Once they are infected, even if it is a very mild infection, it could actually progress to the very severe disease. So we need some plans, not only for just COVID-19, but that's actually true for the flu patient as well. The very simple thing is that we're wearing masks. If people think that they are vulnerable, belong to the vulnerable group of people, then they have to just wear especially the masks and also washing hands, and then they need plans just in case they got infected by this COVID-19. So one thing is that we have a very effective antiviral drugs right now. So, but in order that the drug to be very effective, we need to get very fast diagnosis and then starting the treatment as soon as possible. So everyone, especially belonging to this vulnerable group of people, needs just a plan just in case when they are infected.
Right, a responsible individual plan.
Sure.
Then. Professor Kim, there's also been reports about Paxlovid leading to COVID-19 rebounds, of course, but now a new study suggests that rebounds occur even in the absence of Paxlovid. Could you tell us more, and could you also tell us a bit about the rate of rebounds here in Korea?
Well, I guess the rebound phenomenon after Paxlovid in patients with COVID-19 varies a lot. There was a report about 1.7% of patients have another outbreak, discharge of viruses, even though they had Paxlovid. But some reports from Harvard, they reported much higher rate of rebound of viruses after COVID-19 infection without a Paxlovid treatment. So I think we cannot say the Paxlovid is causing the rebound of this COVID-19. Instead, we have to remind that what is the indications of Paxlovid? What kind of patients are indicated to have Paxlovid? They're usually elderly people and patients with underlying conditions. And if you are elderly, your immune is not that strong, and the immune response of those patients are weak. So I think that might be the cause that those patients might have a rebound of viruses. So I think if you are indicated for Paxlovid and you are elderly, we use only 5 days of Paxlovid therapy, but I think we might need a little bit longer period of Paxlovid for those cases.
Right, I see. Dr. Kim, yet another study is said to show that COVID-19 infection is linked to a 40% rise in autoimmune disease risks. Could you tell us a bit more about this particular finding?
So the new thing about the study you talked about is this actually study covers a lot of just the patient sample. So there's a large scale study, but even just earlier, just pandemic, there was a report that the autoimmune disease is somehow associated with the long COVID, which is a post-acute COVID-19 sequelae. So, and then this is not just completely new, but the large scale means that now the sort of just association is more just strong compared to the past that we actually just suggest. And for this long COVID, it's still just some mystery, and then many people, even just the scientists and the clinicians in Korea and also just foreign countries, are actually just studying this long COVID very just intensively. And then for now, well, well, according to some statistics, maybe 10% of the COVID-19 patient actually suffer from this long COVID, and the autoimmune disease autoimmunity is actually considered as one of the causes of just long COVID. In addition to, some people say maybe some very residual, just the virus is still just remaining in our body and then just causing this problem. So there are many just potential reasons of COVID-19, and also there are also many, well, at least dozens of symptoms of the long COVID. So still we are still immature. We are not immature the face of the understanding all those phenomena, including long COVID and then autoimmune disease at this moment.
Right, and staying with long COVID, Professor Kim, what can you tell us about this particular phenomenon of COVID-19 here in the country?
We started to recognize that we have kind of this chronic problem since 2020, and there are many terms about it: long COVID, long haul COVID, post-COVID syndrome, post-COVID conditions. I think in the academic arena, they use the post-COVID conditions. And if you have symptoms more than 12 weeks after acute infection, you can say you have long COVID or post-COVID conditions. And
what are some of the conditions that you would see after 12 weeks?
Well, it's very heterogeneous. I mean, you might have a lung symptom, you might have a neuropsychiatric problem, you might have a heart problem. You can also have a gastrointestinal symptoms, and it varies a lot. And it can last even more than 6 months. And recently we have a Korean data about this long-term problem, and about 66% of patients after acute infection, they can have some kind of symptoms such as fatigue, concentration difficulty, and memory or cognitive problems. They may have anxiety and even depression. And about 53% have the symptom more than 12 months. So it causes a lot of problems. But anyway, it subsides gradually by time. And this post-COVID condition can happen in a patient who had a mild disease, mild infection, and even in young generation. So still we have to collect our data and accumulate it to have a correct picture, exact picture of this one. For children, it's rare to have this kind of condition, but we have a special disease called MISC, which means multi-organ inflammatory syndrome after COVID. The incidence is less than 0.3% of those COVID-19 cases in children. It happens about 2 to 4 weeks after the acute infection, and really many similarity with Kawasaki disease. But anyway, we can manage it, and you have to send this patient to the tertiary university hospital. We have many questions about this long COVID condition, like can vaccine help overcome this post-COVID condition? The answer is not clear, but we say probably. Maybe we can shorten the period of this post-COVID condition if we have a vaccine booster. It's from the UK study. Well, as Professor Kim mentioned, all this post-COVID condition is related to inflammation. All is about inflammation. So if you have this kind of problem, we have to think, how can we overcome this chronic inflammatory situation? And if you lose your appetite, you might have some kind of deficiencies, such as vitamin D, E, or A, or something. And you might have a poor diet, unbalanced diet. So many scholars recommend to have a food naturally containing bioactive components with anti-inflammatory and immunostimulating activities.
And what would be some examples of those?
Like a Mediterranean diet and some antioxidative diet with many kinds of berries and such and such. That is some recommendation they have right now.
Right, I see. Well, talking about long COVID, Dr. Kim, it seems very important to kind of prevent the disease instead of focusing on the cure as well. And having said that, do you see COVID-19 vaccinations as becoming perhaps a regular recommendation like the flu vaccine?
That's one possibility. And then I have to say that there are some differences between just the flu vaccine and then now just the COVID vaccine. And one of the main differences for the flu is, well, the infection itself is for the flu is seasonal. We normally just experience in the winter season. So the criteria that we actually choose some vaccine strain is based on the circulating just virus strain on in our case is southern hemisphere. So then there's some season, but in the case of COVID-19, as we have experienced so far, it's a year-long, just infection. So there's some substantial differences, and also the vaccine efficacy. The flu vaccine is mostly just raises some antibody responses. So which these responses does not last long. So sometimes, so that's why just some people actually recommend a second shot. If the people got the flu shot very early in the fall season, they might just experience a very decline in just immunity. So some people got just recommended the second shot. But for the COVID-19 vaccine, in addition to just raising the antibody responses, especially just mRNA vaccines, they actually raise very good just T-cell responses. And then this T-cell response is long-lived compared to the antibody responses. So there's some differences in terms of infection, also season, and also the vaccine efficacy. So one particular the thing, if we actually administer like some any just a regular recommendation, I think it would be good just the vaccination, sort of just the double vaccination with the flu vaccine and the COVID-19 vaccine, because if someone is actually infected by the flu and the COVID-19 at the same time, that actually makes us the situation more worse. So at least if we have to just administer, I mean, just recommend just regular vaccination for flu and then the COVID-19, I would suggest maybe just maybe fall season we just the vaccine just vaccinated with against the flu and the COVID-19 at the same time. But again, for the COVID-19, we have to also just keep in mind that whether we are actually pursuing the prevent infection or preventing the severe diseases. For the COVID-19, at least the thing that we have known so far is the COVID-19 vaccine is still very effective against preventing severe diseases and death. But for preventing infection, we might have to just recommend more shot, at least well twice a year or just 3 times a year. But that's something we cannot actually attain that's practically in the real life.
Right, I see. Professor Kim, as Dr. Kim mentioned earlier, the World Health Organization says that COVID-19 remains a global health emergency. That being said, when do you expect an ease in this particular alert level?
Well, domestically, I think it's already entering the stage to consider, changing the alert level. But if we turn our clock back to January 2020, many doctors already recognized that something is happening in Wuhan, and we were waiting for the WHO to make alerts or declare the pandemic, but it didn't happen till the 11th of March in 2020. It was a little bit late, but I think WHO will be very conservative to downgrade the alert level, because WHO considers that many countries are still hobbling, fighting against COVID-19, especially the countries in the development stage. If I mention a little bit about the US guidelines of the alert level, the new cases should be less than 10 cases per million per day. And the highest level is level 4, which is about 40 patients per million per day. And I just mentioned that Korea has just reached the level of less than 200. So that means we still have patients enough to be alerted. And as I reviewed the news outlet from WHO is very concerned about the war happening in Ukraine, and also the earthquake in Turkey and Syria. This kind of disasters makes a lot of refugees, and if you have refugees, you have a big problem controlling infectious disease, and something new might happen. So in this situation, I think WHO will be very conservative to downgrade the alert level.
Right, of course, understandably. Dr. Kim, back with the situation here in the country, given our situation with regard to COVID-19, do you suppose it's still reasonable to perhaps invest in seeking a cure or vaccine against COVID-19, even as we face the final stages of this pandemic?
Well, I think we still need to just invest for more. There are some couple of reasons, and then number one is actually just the variant issue. The variant, whenever we see some news about some new variants, then everybody is concerned about the efficacy of our treatment option, especially just monoclonal antibody. So that's why we now no longer recommend the monoclonal antibody treatment for COVID-19, because all of the approved just monoclonal antibodies now, they lost substantially their neutralization capacity. And also, we are also concerned about some vaccine efficacy. Although, I mean, especially just the neutralizing antibody levels do not actually, those antibodies do not neutralize just substantially well as before. So that's the one concern. And then there's some report about some resistance mutation. Resistance means resistance against some remdesivir and even just Paxlovid. But very specific cases, like lab settings or some immunocompromised patient, but at least we confirm the existence and the potential to just emergence of resistance mutations of this virus against the drugs that we are actually using right now. So that's kind of a reason. And also for the vaccine, well, the people are thinking about some universal vaccines, which means that the universal vaccine is very effective against all kinds of just the SARS-CoV-2, regardless of emergence of all sorts of different variants.
Right, and we'll keep our fingers crossed for that, of course.
Right.
Professor Kim, as I mentioned earlier, the academic year has begun here in Korea. What are your words of advice for those in the academic arena?
Since the outbreak of COVID-19, many things changed. A long time before, I mean, long ago, we used to send our kids to school even though they have a fever, even though they're coughing, even they have a possibility to spread some kind of respiratory tract infection. They just went to school, but pandemic has changed many things, but this is the positive aspect of this pandemic. Now we understand that if you have a fever, you better keep your children at home until it's okay. And I think even though this pandemic is turning into endemic and might end, I think we have to continue to keep this kind of policy because it's medically correct. So I wish that this new school semester will continue this policy with children. And hand washing is always important. Even though we don't have a pandemic, hand washing, personal hygiene is very important. World is getting more smaller every day, and we know that this COVID-19 virus spread like a wildfire very fast all around the world. So to keep this to keep this under control, I wish that we, as we learn the new lesson, we keep it with that.
Right. Be more cautious and wash your hands, ventilate as well then,
Yes.
right? All right. Professor Kim, as always, thank you very much for your time and your thoughts.
Thank you.
And Dr. Kim, thank you so much for your insights. Right, well, that brings us to the end of this edition of Issues and Insiders. Thank you for watching. See you same time tomorrow. That would be Friday.